Higher Health says issues impacting student success have been exacerbated during the COVID-19 pandemic. As post-school education and training systems open to allow more in-contact classes on campus, Higher Health says it is gearing to put in place capacity, systems, infrastructure and controls towards engaging the challenges affecting young people. For more on this story, we're now joined by the CEO of Higher Health, Professor Ramneek Ahluwalia. Professor, a very good morning to you. Thank you so much for joining us. Welcome to the agenda.
Morning to everyone. Morning to you, sir. Thank you.
Now, the University of Johannesburg is one of the universities that has introduced mandatory vaccinations for students. I mean, some students are against it. So what's your take on this?
Yeah, I think we're following what the government has put in together at this moment, which is that let's not go into what we call it as mandatory vaccination for now. But we are putting up something, what we call it as guidelines in advising our institutions of higher learning on understanding of how and we put regulations when it comes to vaccination at this moment. Now, the most important part that we have to understand is that when you are in a congregation of settings, which means you are in closed classrooms, and when the ventilation is less, wearing of mask and having vaccinated people inside brings full strength of our institutions to start our academic year, which has suffered over the last 2 years. We've seen pressures from parents, we've seen pressure from students, and they're right, because you can't do everything online. I can't understand how I, as a medical doctor, can learn medicine completely online. Similarly applies to engineering. When you go to TVET colleges, it applies to plumbing, mining, electrical, any industry that we speak about when we are building skills. It can be done through a hybrid mechanism, but not online. So this means that our academic year needs to change by bringing people together, in congregations together, in classrooms together. And when institutions of higher learning are now considering bringing this reality of our students, our young people together in congregation, they are looking at 3 parameters. The one big parameter is ventilation, how good the ventilation is in the classrooms. The second big parameter that they're looking into is the issue of mask wearing. Because when you will be in crowded spaces, when you will be in closed places without ventilation, mask plays a very significant role. And the third big parameter is vaccination. Now, in vaccination, there are 2 questions. One, for those students who are vaccinated, for those staff who are vaccinated, their rights say, why should we be vulnerable to be mixing with people who are not vaccinated, who probably have a higher chance of getting a severer infection, who probably even have a higher chance of fatality or death to this condition. Similarly, the students and staff who are not vaccinated have a query to say they have equal rights for them to be educated. So in order to balance this, there has to be guidelines, there has to be process of consultation that we have embarked very rigorously. I'm sure very soon you will hear announcements around the guideline regulations that are coming out from Higher Health, which then advises each and every institution towards putting what we call it as regulatory vaccination, in which settings, in which faculties and disciplines, and why vaccinated people needs to be brought in congregation. And if those students who are exempted or not taking vaccination, how do we do a weekly test to bring them in only closed congregations? So that's the balance we are striking at this stage.
You know, Professor, you mentioned guidelines and the issue of consultations. I mean, I've had this conversation countless times with so many people from the business sector, from the higher education, from the tertiary sector, the most recent being the University of the Free State. And we do understand that there's ostensibly a different entrance for vaccinated and unvaccinated students. So in as much as it is very imperative that universities should protect the lives of those vaccinated and by extension the lives of all citizens of South Africa, but I suppose then that the issue of the rights of students, their rights to choose to get vaccinated or not, should also be respected. And there are also issues of cultural and religious affiliations.
Definitely, I fully agree with you, and that's why it's not an easy thing for any government, for any institution. In higher education, we have a Higher Education Act which allows our universities, our institutions to make autonomous decisions, which means that we can put some guidelines and some principal parameters, but they look at their Occupational Health and Safety Act, their own environment, their own type of courses they are offering, the exposure rate that they are looking into, the scenarios of thinking, and they can make their autonomous decisions. But from higher health perspective, which obviously works from the department perspective, we'll be putting up perspective guidelines, which comes straight from the consultative processes, which looks after these small parameters, big parameters, which you've spoken about, the rights of every student to education. It's the right of every student to feel the system of refusing vaccination. And if they do refuse vaccination, what are the exemption criteria of refusal? Definitely cultural is one, and religious is very important criteria. And the third one is medical criteria. And beyond the criteria, if the student still chooses not to be vaccinated, how do we ensure that he or she is safely brought into the campuses, how they can still be in the congregation of closed rooms where we can still have full classroom activities and still run the whole curriculum program. And these are exactly how the guideline speaks about how do we do weekly tests for students, make them easily accessible and available at the institution so that they can have a negative test to go. This is only for their safety at the end of the day, because at the end of the day, a person who is not vaccinated has an extremely high risk to death and severity of the infection. And the viral load bounds to be more because there is no mechanism to counter that compared to a vaccinated person. And keeping that parameters together, we are working on this. So that definitely the word regulation is wrongly used. The word mandatory is wrongly used. What we have to use is the word is accommodating everyone and ensuring that we still have classrooms and we still have activities in the congregations. We still have our residences with students who are from a very poor, disadvantaged backgrounds who need our residences for accommodation. We have to ensure that equity or equality for education remains in paramount towards how do we proceed. So I think that's what we are working on guidelines, not the word mandatory, but we are working on parameters or processes of how we bring vaccinated students, we bring non-vaccinated population together in a congregation so that academic sessions can happen. And now we can move out of and say more academic skills and more skills for our economic perspective, which is absolutely needed at this moment.
Now, Prof, what are some of the issues affecting students and their ability to succeed?
I think you're absolutely right. What worries us is not just COVID-19 now. COVID-19 is an epidemic. It's going to probably become endemic. And when I say endemic, I want to remind our viewers, endemic is still equally as dangerous as epidemic, because in endemic, you have lean periods of low infections, but you also have seasonal strong variation, which do kill people. And we need to be mindful, even though COVID-19 starts becoming endemic with time. But the question is, what we have other endemics and pandemics that remain killing our young people. When I say 8.1 million South Africans live with HIV, and young people are predominantly, that's affect our economy. That affects our graduateness, that affects our graduate success. When we talk about mental health, and we see that 62% of our students are moderate to severely anxious and depressed with severe academic stress, anxiety. COVID-19 has grown, there's bereavement in families, there's economic challenges around. These are real epidemics around us. Gender-based violence. If we all know 1 in 3 women before the age of 21 in South Africa is sexually violated or assaulted, how do you expect a student to graduate when she has an abuser at home, or she is sexually harassed on routine basis by a partner or intimate partner violence, and then she has to compete in this dreadful world of getting a good graduate success, ensuring that she is successful? And when we say that teenage pregnancy is a reality, when we say 1/3 of our students become pregnant on campus and only 10% of them come back to education, we lose a brilliant economy out of our student population. And this thing continues and continues around it. So I think financial needs, poverty is a very severe stressor. We are not a very privileged country. We're just a country of 27 years old. We've inherited a difficult past. A lot of our children, our students are coming from single parents, abusive backgrounds, and they have to fight competition in unemployment is on the rise. So these parameters become the social, the health, the development challenges of the youth becomes equally and paramountly important for South Africa as much as the financial challenges around it. And that total makes the youth. That total makes a holistic graduate. And I think what we need to in South Africa agree is that we need to continuously balance pressure on COVID, definitely is the need of the hour, but not forgetting our existing social and health challenge. And I think the balance strikes to save people around.
And in terms of the social and the health challenges facing students, I mean, how are you helping students across the country to overcome these very issues?
In fact, I would use an opportunity to market a number, 0800363636. I repeat, 0800363636.
Okay.
24 hours, toll-free crisis helpline, established by Higher Health. Psychologists, counselors, social workers, 24 hours available. You are not alone. We understand when a person 2 o'clock in the morning, with bereavements in families, economic crisis, academic stresses, suicide is a reality. Gender-based violence is a practical reality in this country. But one should not find themselves alone. You need to talk. You need to engage. You need to engage a specialist. We need to get stigma out of our mental health. You need to engage. And that's why these 24-hour crisis line exist. Please use them. And I plea and beg every student around this country. Last year, we saved 17,000 lives. These are suicidal people. These people who call late in the night or early hours of the morning about to take life and probably pick up a phone and engage somebody. And somebody who's a specialist. It takes 3 days to avert a crisis. And then you're referred to a psychologist, you're referred to a social worker. These are important parts of our existence. The world we're entering into is not the same world which was more caring. The world that we are entering into is competition, there's unemployment, there's the realities of South Africa exist, the reality of the global world exists. And what we need to do is we need to find resilience in our population, support them, build care and mechanisms around them. Then every service, whether it's your HIV testing, your ARVs, your contraceptives on daily routine places, if you're in a campus, they come on routine basis through Higher Health around your campus. It comes in the form of wellness days. We have an agreement with every college campus or university campus or a TVET campus that 2 days in a month be dedicated just to health and wellness days. Like we do employee wellness and discovery comes or medical aid comes and puts blood pressure and sugar and all those things. For a poor and for our resourceless environments, we should still do that. Wellness days should be popular among young people. Life is once and young people needs to prioritize their life because we need them. And that's only the way South Africa will grow. And I think bringing access of easy services to young people is the way forward. So we appeal people to use these services, look after their health, because this is paramount for this country.
And there's different facets, Professor, of the health challenges affecting students. And I suppose the most important is the mental health, in particular of university staff members, which is often neglected and might have been exacerbated during the coronavirus. I mean, levels 4 and 5 lockdown served as a drastic intervention to contain the spread of the virus and saved so many lives and resulted in the restriction of university staff members to their homes. So it posed, I suppose, a direct threat to the successful progression and completion of the 2020 academic year for universities, and its impact on the mental health of staff and students was of concern. Should the mental health of academic staff have been taken into consideration?
Absolutely. I think it's not just the students, it's staff, student, stakeholders, parents, the whole system around the post-school education training system. It's not been easy times. Our studies have clearly shown, impact has clearly been shown. When I say 62%, it's a huge rise of young people facing psychosocial anxiety and depression. And what we've seen is clear reasons. There's bereavement in families. Parents have lost jobs. There's economic distress. There's a massive academic distress. What used to be in classroom activities, what used to be peer-to-peer education, what used to be knowledge sharing, what used to be learning from each other, interactive sessions. You're sitting at home and are pushed towards an online platform to be in the same skill as expected to build in your economic streams and get a qualification, which will obviously help you. What you eventually want is a job employment. What every mother's hope is that my child will eventually get a job and earn and look after the whole family. And in any average South African family, you will see there's only one bread earner, one person from an institution of higher learning who has the onus to earn and look after their siblings, their children, everyone. So I think your point is absolutely right. Academic staff are equally isolated, have same returns to be given. They have same pressures, they have same family environments around them. So I think it's this number that is said is not just staff, the students. Yes, students are our biggest beneficiary. They are more disprivileged, they're more underprivileged, they're more in rural areas, coming from very poor backgrounds. South Africa is transformed, and we're very proud of South Africa has transformed. We are building a nation from one of the more poor backgrounds to be given possibilities for a hope of economic skills or skills building in this country. But they have challenges. We need to give them the first access. But staff usually have medical aid, staff usually have support structures. We appeal them that the mental health has a stigma attached. Work out of the stigma.
Just picking up on that point, Professor. Yeah, just picking up on your last point. I mean, we seem to be ignoring the stigma around the mental health of men, and that particular stigma stops so many men from seeking help when they need it the most, and it's killing them. How do we help men seek help when it comes to their own mental health?
Peer-to-peer. It has worked. Higher Health has an army of about 20,000 foot soldiers, which are peer educators. A lot of strength in them, in an army of men among those peer educators. Talking from a person who experiences mental health as a peer and speaking to another man who might be in a similar area and understands the same language, influences and fights the stigma around. We fought HIV in a similar way. There was no other way than for HIV positive people to come out and engage and say, well, they're HIV positive, they can still live. They are on ARVs. That's how we promoted ARVs. We brought HIV from an epidemic to be a controllable pandemic in a way that we could bring treatment, we can bring testing, we can bring prevention. Similarly is mental health. It's a similar pandemic. It's a pandemic in general, where we still need a warrior of people who are survivors of mental health, men who are survivors of mental health, to come out openly, build a system. We are doing the same in higher education because there's nothing better than to a peer influence. I can speak a million times as an academic, as a specialist, as a medical doctor, as a person who can give knowledge, but nobody can translate a better information than a survivor of mental health, a peer to another peer who's facing and understanding the relationship. So I think in every industry, whether you're in an academic sphere, a growth of a peer-to-peer information is very important. A peer-to-peer education program is important. Building peer system is important. And I appeal institutions of higher learning, industries, businesses to invest in their employees, to invest in something called peer networking, peer knowledge sharing. This is the way to grow. But from Higher Health, you can join a curriculum which is online, which is in classrooms available, not just for higher education fraternity, for anyone in South Africa. We have a curriculum on mental health. You can learn mental health through an interactive classroom-based perspective, even through online. You learn the basics of what needs. It's at a grade 8 level. It's a qualification that is equivalent to NQF level 4, but you'll understand mental health. And then you do risk assessments about your life on mental health so that you know at what risk are you on mental health. Where the aim of only fighting stigma is education and peer-to-peer understanding.
All right, Professor, lovely chatting to you. Thank you so much for sharing your thoughts with us.
Appreciate it. Thank you.
Thank you. That was the CEO of Higher Health, Professor Ramneek Ahluwalia.